Shyanne Medrano was 31 years old. She lived in Houston, Texas. She had a daughter, 8 years old. And in March of 2023, Shyanne crossed the border into Matamoros, Mexico, for a Brazilian butt lift. The clinic was called Clínica K3. The price was a fraction of what she would pay back home. She went in healthy, strong, excited. She came out with a headache. She thought that was normal. Post-surgery pain, part of the process. She went home to Houston. She went home to her daughter. 2 months later, Shyanne Medrano was dead. And she was not the only one. 12 women died in this outbreak. 12 women who flew to Mexico for an affordable surgery. 12 women who came home with a headache they thought was normal. Medical tourism is one of the fastest growing trends in cosmetic surgery right now. Millions of women cross international borders every year to Mexico, to Turkey, to Colombia, to access procedures they cannot afford at home. Lower price, same result. That is the promise. And sometimes it delivers. But here is what most clinics do not put on their website. Every surgery requires anesthesia. For procedures like a BBL, a Brazilian butt lift, surgeons commonly use epidural anesthesia. Think of it like a precise injection into the space just outside your spinal cord, like slipping a note under a locked door. It numbs everything below the waist. It's standard. It's effective. But here is the risk that no price comparison website mentions. If the medication inside that injection is contaminated, with a fungus, a bacteria, anything living, it goes directly into the most protected space in your entire body, the space around your brain and spinal cord. Have you ever looked up cosmetic surgery prices in another country? Did the price feel almost too good to be true? Question I want you to hold on to. The fungus that killed Shyanne Medrano has a name. Fusarium solani. Say it. Fusarium solani. It lives in soil, in plants, in decaying organic matter. Under normal circumstances, a healthy immune system keeps it out. But inside the space around your brain, injected directly through contaminated anesthesia, it becomes something almost impossible to fight. Here is why. Almost no antifungal medication works against Fusarium solani. The drugs doctors reach for in emergencies, the ones that kill most dangerous fungi, this fungus resists them. The CDC published their final data in 2024. 24 patients were infected, 23 of them were women. 12 of them died, 50%. 1 in 2 women who were infected did not survive. Not from a rare disease in a remote village, from a cosmetic surgery trip across the US-Mexico border. And here is the number that should stay with you. 212 American women in 25 different states were identified as potentially exposed. 212 women who had no idea. Before moving on, here is the exact question to ask your doctor. What type of anesthesia will I receive, and how do you verify the sterility of that medication before every single procedure? This did not happen suddenly. January 2023. Women begin having cosmetic procedures at 2 clinics in Matamoros, Riverside Surgical Center, and Clínica K3. Normal days, routine operations. No one knows anything is wrong. March 2023. Shyanne Medrano has her Brazilian butt lift at Clínica K3. She goes home to Houston with a headache. She rests. She tells herself it's normal. May 2023. The CDC issues its first emergency alert. Health Alert Network 491. Doctors across America are told to look for unusual meningitis cases in patients who traveled to Matamoros. May 16, 2023. Shyanne Medrano dies. On the same day, the exact same day, the Texas Health Department announces its public health investigation. June 2023. A second CDC emergency alert goes out. The list of potentially exposed women reaches 212. Both clinics in Matamoros are closed. 2024. Scientists publish the full analysis. The fungus did not just infect the outer membrane of the brain, it attacked the brainstem directly, the part that controls your heartbeat, your breathing, everything. And here is the question to ask any clinic abroad. Is this clinic licensed by the National Health Authority? Can you give me the license number so I can verify it myself? Here is the detail that changes everything. Shyanne went to Clinica K3. Other women went to Riverside Surgical Center, a completely different clinic across the city. Both groups got infected. How? One anesthesiologist, one person. He worked at both clinics. He moved between two separate operating rooms, carrying the same contaminated medication. One vial, two locations, 12 deaths. Did you know that a single staff member working across multiple facilities can connect hundreds of patients to one contamination event? Most people don't. And here is the thing that made it so deadly. The symptoms of fungal meningitis do not arrive immediately. Not the next morning. Not even the next week. They appear days to weeks after the injection. A headache, neck stiffness, back pain. Things that feel completely normal after surgery. So these women went home. They rested. They told themselves, this is healing. By the time they understood something was wrong, by the time doctors connected the headache to a procedure performed in Mexico, the fungus had already reached the brainstem. For many of them, there was nothing left to do. If you are planning surgery outside your home country, or if someone you love is considering it, here are 4 things to do before anyone books a flight. 1. Verify the clinic's license. Not the reviews, not the before and after photos. The actual operating license issued by the National Health Authority. In Mexico, that authority is COFEPRIS, the Federal Commission for Protection Against Sanitary Risks. Ask the clinic to send you their license number. Then look it up yourself online. If they refuse, that is your answer. 2. Ask specifically about anesthesia. Who administers it? What type? Where is the medication sourced? How is sterility verified before every procedure? These are not rude questions. They are your legal right as a patient. 3. Do not travel alone. Every woman who recovered faster in this outbreak had someone beside her. Someone who could say, "This headache is not normal. We are going to the emergency room now." Go with a friend. Go with a family member. Do not go alone. 4. Know the warning signs of meningitis. Severe headache, stiff neck, fever, sensitivity to light, nausea or vomiting. If any of these appear in the days or weeks after surgery, go to the emergency room immediately. Tell the doctors exactly where you had surgery, what country, what clinic, what type of anesthesia was used. Those specific words, that specific information, could save your life. Shyanne Medrano wanted to feel good in her body. She saved her money. She did her research. She made a plan. She crossed the border looking for something better. She was 31 years old. Her daughter was 8. She went for a surgery that costs thousands less across the border. She paid with her life. This is not a story about recklessness. It is not a cautionary tale about vanity or bad judgment. This is a story about a system with no guardrails, a clinic operating without real oversight, a contaminated supply, one anesthesiologist moving between 2 operating rooms with no one checking his equipment. The failure was not Shyanne's, but the knowledge is now yours. You know something today that Shyanne did not know when she boarded that plane. You know about Fusarium solani. You know to ask about anesthesia protocols before you walk into any operating room. You know to verify the license yourself. You know to bring someone with you. That knowledge is not a reason to be afraid. It is a reason to be prepared. The procedure you want is not out of reach, but reaching for it with your eyes open, with the right questions asked, the right verification done, the right person beside you. That is the difference between a surgery that changes your life and one that ends it. You have the power. Use it.